Governor Rick Perry is calling for a ban on air travel from West African countries affected by Ebola. He also wants the president to think about putting healthcare workers and others with close contact with Ebola patients on a no-fly list. 2 of the 3 Dallas Ebola patients had recently traveled on commercial flights, including one from Liberia. Now airlines are working out how to handle suspected Ebola cases in the air. Fox 4's Zahid Arab talked to a flight attendant about their concerns. Zahid live now from DFW Airport with more. Zahid.
Well, Heather, on airplanes, you used to just worry about sitting next to someone with a cold or crying baby. But now with 3 cases of Ebola in Dallas, it's tough not to worry about that too.
We are all very, very concerned about the situation.
We can't show you this Dallas flight attendant's face or tell you who they work for, but their concerns are clear.
Who goes to work and thinks, oh my God, I can get a disease and be trapped in, a metal tube with somebody who might have Ebola and not be able to get off for hours, and I have to protect my passengers and myself as well.
They say the issue is an important one, especially after the CDC says Ebola patient Amber Vinson got on a flight with a fever. State health officials say at least 8 others were within 3 feet of her. Right now, this flight attendant says there's no protocol, procedures, or even adequate medical equipment to help those on board address that.
Should they have to be the ones, and are they trained to be the ones to look out for these symptoms?
We are not trained to look for Ebola symptoms. We have never really been placed in this situation. We are trained to look at people to see if we think they're going to be a problem, or they're intoxicated, or if they are ill, that kind of issue. Certainly, of course, we're there for people's safety issues, but we certainly have not been trained about Ebola yet.
Last night, an American Airlines passenger aboard a flight from Dallas to Chicago began vomiting. Concerned she may have Ebola, the crew had her stay in the lavatory the rest of the flight. American Airlines is now creating a task force to establish Ebola policies and procedures.
Air travel is, in fact, how this disease crosses borders, and it's certainly how it got to Texas.
Governor Rick Perry did the same, creating the Texas Task Force on Infectious Disease Preparedness and Response, which focuses on more Ebola treatment centers, testing labs, and training for healthcare workers. The governor is also asking President Obama to ban air travel to countries hardest hit by the outbreak.
He does have the authority to put a no-fly list that the airlines then respect. And that is an option that I ask him to consider to clearly send the message.
Personally, I do agree with Governor Perry. I think it's precautionary.
And with growing anxiety, this flight attendant says crews are calling for changes to help them do their jobs.
I think it's our responsibility to protect them when they hop on our planes.
The flight attendant says it's important for unions to press airline management for more precautionary measures against diseases like Ebola. For instance, gloves and masks. The average flight only has a handful, not enough for all passengers. Heather?
All right, so Zahid, let's kind of do a reality check. How likely would it be that you would actually get Ebola on an airplane?
Well, the CDC says the risk is extremely low. The only way you can get it is by exchange of bodily fluids. We're told most airplanes are given light cleanings between flights, and at the end of the day, more thorough cleanings are done on surfaces like armrests to prevent things like the flu. And Heather, experts say it's much tougher to get Ebola than the common flu.
All right, Zahid Arab live for us tonight at DFW. Thank you.